The disease I've chosen to present on is leptospirosis, also known as lepto. Leptospirosis is a zoonotic disease caused by bacteria called spirochetes. They are found in wildlife species and rodents, and live in surface water, ponds, streams, and moist soil, and cannot survive extreme temperatures or dry weather. Spirochetes can move throughout the body, settling most commonly in the eyes, liver, kidneys, and the mare's reproductive tract. Lepto is contracted most commonly through feed and water. An infected animal can urinate or bleed on the feed or in the water where the non-infected horse will eat or drink it, and the bacteria will enter the body. Horses can also directly contract leptospirosis when an infected animal's urine splashes into the horse's eyes or mouth. If the animal is a carrier of the disease, they can get other animals sick, even if they themselves aren't. The bacteria can enter the horse through the mouth, nose, and eyes, and can also enter through cuts on the legs or the hooves. Lepto most affects the horse in the following areas: the eyes, kidneys and liver, and the mare's reproductive tract. Starting with the eyes, horses can contract chronic equine recurrent uveitis, also known as moon blindness. This occurs when the spirochetes migrate to the eye and will cause the horse severe pain and could result in the loss of one or both eyes, or could cause permanent blindness. ERU is thought to be a genetic problem, and Appaloosas also seem to be genetically inclined to contract this. Moving on to the kidneys and liver, if the certain strain of lepto is contracted, it could cause acute renal failure. This type is known as L. pulmona. And finally, when the spirochetes migrate into the mare's reproductive tract, it can cause abortion, stillbirth, birth of a live, non-viable foal, and sometimes they are viable but very rarely. Non-viable foals are born very early. Identifying an infected pregnant mare is tricky because, unlike other diseases, ones infected with lepto don't often show signs early on. Clinical signs of leptospirosis is as follows: fever, loss of appetite, swelling of the eyes, light sensitivity, tearing, ocular discharge, eye cloudiness, redness around eyes, lethargy, mid to late term abortion, anemia, jaundice, liver failure, and kidney failure. It is often misdiagnosed because these symptoms are shared with other common diseases. The only way to know for sure if a horse has lepto is to do blood testing or urine testing. Currently, there is only one lepto vaccination for horses. It is by Zoetis and called Lepto EQ Innovator. It is given intramuscular of 1 milliliter dose. Then, in 3 to 4 weeks, a second dose of 1 milliliter is given. After that, they should be vaccinated for it once every year. Until recently, people have been using the vaccine for cattle to keep the amount of abortions down. It works, but an equine-specific vaccine would be better. When dealing with leptospirosis, the best thing to do is to be proactive and prevent the disease before it becomes an issue. Any standing water should be drained as best as possible. Practicing good hygiene at your facility is also very important. This includes cleaning water troughs and feed buckets regularly, and keeping feed stored in an area wildlife cannot access. Humans should also avoid direct contact with uterine fluids, placenta and fetal tissue, and urine, since we can also get this disease.